Hey, in today's video, I'm talking about the most dangerous medication that's taken by millions of people all over the world. And little do they know that this medication is actually increasing their risk of developing cancer, heart disease, osteoporosis, chronic kidney disease, and neurodegenerative conditions like Alzheimer's and dementia. And this medication has been linked with increasing an individual's all-cause mortality, meaning their risk of dying of any kind of condition. So what medication am I talking about? It's actually something called a PPI, a proton pump inhibitor. This is given for acid reflux. Some of the most common brands are things like Prilosec and Nexium. So very common and often prescribed. These medications can be extremely dangerous. Why is that? Because they actually suppress your stomach acid production. In fact, proton pump inhibitors are so effective at lowering your stomach acid and getting rid of the reflux, right? The pain, the heartburn, the kind of pain people will feel. They'll actually reduce your stomach acid by 99%. So if you're dealing with acid reflux, they're very effective at getting rid of that symptom, but they never actually get to the root cause of the acid reflux, which is typically going to be related to a bacterial overgrowth or eating bad foods or being stressed or having bad lifestyle activities. And when they suppress the stomach acid, we need stomach acid in order to sterilize the food that we're consuming, in order to kill off bad bacteria that's coming into our body, in order to chelate and absorb key minerals like magnesium, calcium, zinc, and iron. We also need it to break down proteins and absorb proteins. We also need it to trigger, we need good stomach acid to trigger a proton in our stomach called intrinsic factor, which helps cleave and absorb vitamin B12. So what happens when people are suppressing their stomach acid levels by taking a PPI medication? They're not able to absorb minerals, again, causing deficiencies in things like magnesium, calcium, zinc, and iron. Also causing vitamin B12 deficiencies. They're not able to break down proteins and absorb protein effectively. They're also not able to sterilize and kill off bad bacteria and bad pathogens that are coming into their system. So they're more at risk for developing foodborne illnesses, as well as developing things like H. pylori infection in the stomach, parasite infections, as well as small intestinal bacterial overgrowth. All those things cause worse and worse digestion and more inflammation throughout the entire body. So we get a whole myriad of different problems that occur. On top of that, stomach acid is really needed in order to produce healthy bile flow so we can digest fats effectively. So many individuals that are taking a proton pump inhibitor also end up not digesting and absorbing fats effectively or fat-soluble nutrients like vitamin D, vitamin K, vitamin A, and vitamin E. So they end up with fat-soluble vitamin deficiencies as well. So when people are taking these PPIs, again, it increases their all-cause mortality. There's a 2021 study done out of the UK in the British Journal of Clinical Pharmacology, and it actually showed that when people were taking PPIs for 10 or more years, it actually increased their all-cause mortality risk, so their risk of dying early of any kind of condition. And then there was a 2023 Swedish study that showed that when people were taking these PPIs for 10 or more years, it increased their all-cause mortality and in particular, their risk of developing cancer or heart disease. So PPIs, again, can be very effective at getting rid of the symptoms of acid reflux, but they never get to the root cause, and they cause a whole myriad of different problems that increase your risk of developing any kind of chronic disease, and in particular, cancer and heart disease. Why is that? Because again, these nutrients are so key. For example, vitamin B12 is really important for developing good blood vessels as well as the myelin sheath on the nerves. So good red blood cell function, good oxygenation to all the different cells of our body, proper myelin sheath that protects the nervous system, and also very important for reducing a very inflammatory compound called homocysteine in our bloodstream. Homocysteine, when it's elevated, this homocysteine will actually cause damage to the blood vessels, increasing your risk of stroke and heart disease. So really, really problematic. So vitamin B12 for just say vitamin B12 deficiency alone, that would increase your risk of all-cause mortality. But then on top of that, You think about if we're deficient in zinc. If we don't have zinc, we're going to have poor immune function. That's going to increase our risk of developing cancer. It's going to increase our risk of developing heart disease, all different types of chronic conditions, magnesium, calcium. If we're not getting proper protein, we're not going to recover from exercise effectively. We're also not going to be able to produce healthy blood cells, right? White blood cells, those are proteins. So we got to be able to absorb our protein effectively. Now, our stomach acid does this. At rest, normally our stomach acid is roughly about 2.2 to 3.0, somewhere in that range, 2.5 to 3.0. It's very acidic, but not acidic enough to digest steak. In order to digest a heavy protein, we need to get our stomach acid down to roughly 1.5 to 2.2. So that's actually very energy demanding in order to make that shift and produce that amount of acid. If we can't do that, food will just sit in our stomach and it will start to rot. And when it rots, it produces gas. That gas will push up against our esophageal sphincter, the little muscle that actually protects our esophagus from acid. And when it pushes up against that, it pushes that esophageal sphincter up. Acid now jumps into the esophagus and causes heartburn. And so when people have acid reflux, it's not because they have too much acid, it's because they have too little acid and they're not digesting their meal. They're creating gas that's driving up acid flowing into the esophagus, causing those uncomfortable heartburn type feelings. And so by suppressing acid even more, you're actually going to cause even worse digestive symptoms. Overall, you're going to cause less stomach acid problems, but more problems downstream when it comes to, or less acid reflux, but more problems downstream when it comes to sterilizing and killing off bad bacteria, digesting your food effectively. And this is what people are doing every single day. Now, there's a couple different types of acid reflux medications. One is actually an H2 blocker, which blocks histamine production. Now, that has its own set of problems, but it's actually been shown to be a little safer than PPIs, these proton pump inhibitors. And so an H2 blocker only reduces stomach acid by about 70%. So you still have some stomach acid in there, whereas the PPIs reduce it by 99%. So you're left with very little to no stomach acid to be able to sterilize your food, digest your meals, and absorb nutrients. So if you have to take one of those medications, the H2 blocker would be preferred, and only take it for a very short period of time, maybe a week or two. Meanwhile, work on changing your diet. Get rid of foods that you might be sensitive to, ultra-processed foods, foods maybe high in gluten, or foods that are high, perhaps if you have a dairy sensitivity to dairy. Start looking at different foods that you may have sensitivities to and start looking to eliminate those. Don't eat late at night. A lot of people develop acid reflux because they eat right before they go to bed and then they lay down and the food actually just, kind of sits in their stomach and then pushes up and causes reflux into their esophagus. And so try not doing that, right? Try living a healthy lifestyle, going out, taking a walk after every meal, making sure that you're hydrating well between meals, but not drinking too much with a meal. If you drink too much with a meal, you can actually dilute your stomach acid levels and cause poor digestion. So don't drink a lot with a meal. Hydrate well between meals. That's one of the key factors. I've talked on my podcast and videos about a wide variety of different nutrition principles to follow to help improve gut health, to help improve stomach acid production. So be sure to follow those. One easy thing is take a little apple cider vinegar or ginger tea and have that before a meal, right? Drink some ginger tea before a meal, or have maybe a tablespoon of apple cider vinegar and 4 ounces of water. Drink that before a meal, and that will help stimulate your vagus nerve and stimulate better stomach acid production so you can digest your meal more effectively. So try that out. Now, finally, some people have a hiatal hernia, and that is where part of their stomach has actually pushed up through the diaphragm. And for these individuals, they can develop more reflux. And there are certain things you can do for a hiatal hernia. For example, in the morning, you can drink some water, drink a cup of water, and then jump up and down. And actually the weight of the water in your stomach and then the jumping can actually push, or pull, I should say, your stomach down through the diaphragm, getting rid of that hernia. Also, making the dietary changes, reducing things like caffeine and alcohol can help improve a hiatal hernia as well. There's also a self-massage where you can actually kind of get in the upper left quadrant and push down and kind of push the top part of your stomach down through the diaphragm and get rid of that hiatal hernia. So a couple key strategies, but the biggest takeaway is If you're taking a PPI or any sort of acid blocking medication, take it for the shortest amount of time. Meanwhile, get to the root cause, address why you've got the reflux, and get off of these medications before they increase your all-cause risk of mortality, or of morbidity and mortality, of developing a disease and dying early. So that should be the number one takeaway. Please share this with anybody that you know and that you care about.